do you feel that they're your notes?
Mm-hmm.
So the thing is, the way I look at it, if they can access it, the difference I see is they're not your notes, because they would not be able to access it, just like my notes at home. Nobody should be accessing those I have in a filing cabinet. So how is it that they're able to access your notes and my notes they're not?
Yeah, because yours is like a private server, they can't access, they don't have any access to it, but here they can access the computer itself, but they can ask for the records.
All right. So the confusion is, I was reported that you had, and I rightfully so, you were stressed out by the fact of that request. And then what I'm saying is, the difference is, I don't feel that they're anybody's notes if they can be accessed by a party other than the originator. Whereas if they were your notes, you would only have access to, just like my notes at home. Nobody, if they did, they'd be in trouble. So to me, it's not the notes. And this is the same situation I ran when I was going to the provider for 10 years. They always said, like yourself, they're their notes. And yet they didn't even know that emissary people were reading them off to me. And I recorded them and so forth and so on. The whole thing is, I got to tell you, I'm not here by choice, by my wanting to go here. I was here because my attorney forced me here. And she'll definitely tell you that. And if it was my way, I would never return back to the mental health field. And I got to be honest with you, you carry yourself very, intelligently and very promptly. But I got to tell you, I think the mental health field is basically a smokescreen, and the reality is that what they really are is what they share, and that is this word. This is what they shared, to fuck word. And pretty much that's what I think of the mental health field in its entirety. Not singling you out,
No.
but generally speaking, I literally think that word. It's disgusting. I hate the industry. I never want to return back to it, and I'm only here because I was told to be here. I feel lied to. I feel betrayed. I'm hurt every day. And the records are still in the hands of these parties. I was originally going to destroy them, then when my attorney got involved, and now they're keeping them. And my attorney has stalled and stalled and stalled. She was supposed to file in September. We're now in November. And I just wanted to show you this is what they were doing behind my therapist's back and my back, and I don't think that's right. The state threatened me, called the cops on me for following this up on them. I don't need to show you that anymore, but...
So basically, Aetna is like trying to destroy you. Why?
Privacy. Privacy and being lied to. 10 years I divulged my personal information. He felt he had, my social worker felt that he had, those records were separated by privilege control, password. Nobody but him can have them. And that if you were to leave, he would have to do something at the end of that time to either forward those notes. But he thought that anytime anything's being released, he can only access those notes. Turns out that wasn't the case. And these, not only him, I have recordings of him, I have recordings of all the people who were under the presumption, all that was their privilege control, they've been lied to by the director, by the program director, the manager, and the associate director, who has been responding to these quality assurance reviews and wanted to make sure they would never know about this. These are what it looks like. Now, I spoke with your office manager who said, you take Medicare, and I appreciate you taking that. But she had came to you with one of those requests, and she has said, it's up to you, that we would never, even though we're getting the requests, we would never act on our own, that they come to you. And then I asked the question, well, does whoever this is, which I know it's you, okay that? And it sounded like she said yes. And I was a little disappointed to hear that. Perhaps maybe you have a standard or a good explanation for that. But if in fact you release anything like what I was correcting, we're going to have differences, and it's not, you don't have to worry about me having Medicare, because I have a difference because when you close the door, you are telling your patients it's confidential. And then when the office manager comes here, we got this request, and they want to get paid and they need these notes. I have a hard time with that. And if that continues, like with Everywhere's, as I told you, Everywhere's, not singling you out, I quite frankly think the healthcare industry is really scum. It's not, deception's never a route to go, and that's where I'm at now. It has completely destroyed me, because who else am I supposed to trust if it's not my psychiatrist,
I know, Scott, but Aetna, they're your insurance provider. They pay for the services. So they have the authority to see what they're paying for.
And the thing is that's your presumption, but you've been lied to.
I mean, possible, but that's what
Okay,
we have to go by.
and there are PhD laws in place to prevent conversational content to be released.